I'm Matt Williams. I work for the crisis resolution teams, deliberate self-harm teams, criminal justice teams in Leicester. I'm a senior matron for those services. My job involves looking at standards, looking at patient experience, patient satisfaction, dealing with staff professional issues and making sure we are effective as a team, looking at safety aspects, making sure people have risk management plans put into their case notes, and the quality of those, and making sure people know what to do in a crisis. The services that we offer as a crisis team, we take referrals from the GP surgeries. Patients that are referred, or service users that are referred to us, get a full assessment of their needs. We also take referrals from community mental health teams, from community psychiatric nurses, from other specialist services that work in and around the Leicestershire area. We would do a full assessment of a person's needs, including a risk assessment, and put a plan together as how we're going to manage their current crisis and what that would involve. We involve families, we involve carers involved in the whole process, and we work very close with those. My advice to people, if you are feeling low, if you are feeling suicidal, you're not on your own, there are services that you can access. I know it's difficult, and a lot of people that we talk to do find it difficult to try and access services. You know, you're worried about how you may be perceived, how you may feel, how many people may see you. But ultimately, you know, if you need help, there are services out there that you can access. There are services that you can talk to. You shouldn't sit there with these feelings. You shouldn't sit there feeling that you're alone and you haven't got anyone to talk to. You need to reach out to friends, reach out to family, reach out to the services that are there, crisis lines. Don't sit alone with these thoughts. Sometimes when you're feeling low, sometimes when you're feeling down, you may feel that you've got nowhere to turn, you may feel you've got no one that you can approach and that your problems might not seem that big to other people. But when you've got it off your chest, when you spoke to someone, just that in itself can help. We find that a lot of the times when we do assessments with people, just talking through your problems that you've got now, finding a way forward is sometimes beneficial in itself. So don't sit there on your own with the feelings that you've got. Access services, use the crisis line. We've got the crisis support line you can use. Access your GP services. If you're feeling like you are going to hurt yourself imminently, you need to access emergency services because it is an emergency and you need to get seen. So you can access the crisis helpline number on 0808 800 3302. That's a 24-hour service that's manned at LPT. Leicestershire Partnership Services do provide for people that are in a crisis. Just having those people to talk to, you can also access Samaritans, Focus Line. These numbers are all available with your GP as well, and you can Google them if you need the Samaritans. Access those lines.